talking about health conditions that really affect men. Well, now it is time to focus on something that our next guest really doesn't get all of the attention that it really deserves, and that is senior women and how health conditions affect them specifically. And joining us once again from the MyCare Medical team, we have James Bray joining us, and then Dr. Mary King, who is new to our show. Good morning to both of you.
Good morning.
Good morning.
So James, we're going to talk with you in just a moment. You've been continuing to do these great events across the community, so we're going to get the latest from you in just a moment. But first, let's welcome in Dr. Mary King here to talk about what I just mentioned, and that's how health issues are really quite different. I'm safe to say when it comes to seniors and their health care. Explain that a little bit and why that needs to really be brought up.
Well, the reason being with women, yes, women respond differently than men when it comes to health conditions. A lot of times what they don't understand is there are a lot of outside things that are influencing their health. And a lot of people think genetics. Well, genetics is only 20%. And you have what is called epigenetics. Epigenetics are all the outside forces that are influencing our health, meaning a lot of the things that are coming out of the food supply. And a lot of those are a lot of, bad things like bad bacteria, fungus, and everything influencing their health. And also, as a result of that, that is causing them, as they get older, increase in obesity, hypertension, diabetes, heart disease, and many other things. So that's the reason they need to see their primary care physician, because we can catch all these things in time to prevent them from getting worsening of their health condition over time, especially with women. Because the other thing that happens with women too is their hormones have a play in this that is contributing to their health problems. And they don't understand it. They're asking questions all the time. Why do I notice I'm getting sicker and sicker as I get older? And not understanding all of these outside forces, including the 20% of the genetics. In my practice, I'm not big on, giving a lot of drugs. I include the nutritional part in it that let the patient know what their body needs in order to improve their health. They're thinking it's medication, but no, they can do much better when we see them earlier in the phases of their condition and get them much better by doing natural supplements first. And if the medication needs to come into play, I will add in the medication as time. My plan is to get them off the medicine as I get them on the right nutritional program. If they do this will help them reduce a lot of their health problems. They'll be more healthier over time, and they will also get a stronger immune system, especially with this pandemic. Their immune system will become very strong, and they will not be at high risk of getting all these diseases or even being at risk of getting the COVID-19 if they're caught early.
You know what I love about you, Dr. King, which I can tell, is that you really are looking at the big picture, and it really sounds like you're wanting to listen to your patients and see what their lifestyle is, see what they're doing. And James, I would imagine, I know you're so happy to have her on your team now. And she's not the only one, though. I mean, you guys really pride yourselves in making sure that doctors are paired up with patients who really can get the big picture.
Absolutely. Dr. King is a fierce advocate for women's health. She's a fierce advocate for health in general, but she's a subject matter expert. She's known to give impromptu presentations and speeches. She's sought out to talk about healthcare, and not only just about the medical side of it, but how do you keep people healthy without resorting to medicine as the first tactic. And so she is very unique, but she is also part of our overall team, and all of our doctors are as skilled and passionate as she is.
Yeah, we've had a chance to meet a number of them. Real quickly, just a couple seconds left. Tell us about this event coming up, James.
Yeah, so we're having a food pantry because part of what we've been talking about with Dr. King is this food insecurity is still an issue, and it impacts people in their health, and they have to make hard decisions. And so because of that, we're going to have a food pantry at the Arc of Hudson on April 6th and one on April 20th at 1 p.m. And that's at 12052 US 19 North. You can check it out on the website. Give us a call. It's going to be in Hudson. And April 6th and April 20th at 1 p.m.
Dr. King, what a pleasure to meet you, even though virtually, and you can tell your passion is just so strong for health issues. And again, what a treat. Thank you both for your time this morning.
Okay.